Many congratulations for the Independence Day, and it is indeed a glorious day. Now, whether you like it or not, whether you accept it or not, the main player to achieve this was this man, and this is his signature, and here he is. I don't need to name him. Apart from him, we had these really towering personalities, Jawaharlal Nehru and Vallabhbhai Patel. Their contributions were mammoth, they were immense. The date of 15th August 1947 was chosen by one person, that is the then Viceroy Mountbatten. For Mountbatten, 15 August was an enormous, massive day, because when he was the Supreme Commander of the Allied Southeast Command, the Japanese surrendered informally. The Emperor over the radio asked his people not to fight anymore, and that was the surrender in 1945 on 15th August. So that is one interesting anecdote which I would like to tell you. And apart from this, we have this interesting study which was published yesterday in The Lancet. The Lancet is a very prestigious journal. This study is important because this is, for the first time, a randomized study has been done in people above the age of 75 years. In this group, the authors have compared the use of statins versus the use of no statins. And this study had a follow-up of 3 years. The median age was 80 years, and this is a French study. What the researchers found was that whether you continued a statin or whether you stopped a statin, the mortality remained the same, that is around 7%. Now, this is a very important finding, but one must bear in mind that these were people who had no atherosclerotic cardiovascular disease, which means they had no previous heart disease and had been on a statin for the previous 1 year as a primary prophylactic. Now, what is the difference between a primary prophylactic and a secondary prophylactic drug? The difference is that primary prophylaxis means that the disease has yet not set in, and once the disease has set in, that is once you've had a heart attack or a stent implantation or a bypass surgery, or you've had a peripheral artery angioplasty, or you've had a stroke, then if you are given a drug that is a statin, that is what is called a secondary prophylactic procedure, or a secondary prophylactic drug administration. So I will repeat, this randomized study had about 1,100 people who had no heart disease previously and had been on a statin for 1 year. Interestingly, 77% of these people had hypertension, 20% had cancer, and 30% had diabetes. Despite this fact, when they were divided into two groups, in one group the statin was continued, whereas in the other group the statin was stopped, it was discontinued. The researchers found no difference in mortality, which means that there is little point in giving a statin to a person who has no evidence of heart disease, who has no evidence of an atherosclerotic cardiovascular problem. Now, this is in the background of a study which was published 4 years back in JAMA. JAMA, once again, is a very prestigious journal. This was a meta-analysis of 21 randomized study, which included primary prophylactic and secondary prophylactic studies using statins. And the researchers have pointed out that in a follow-up of almost 4 years, in these studies where the ages could have been below 75 years, could have been in the 50s also, there was only a 0.8% difference in mortality. There was only a 0.5 4% difference in stroke, and a 1.3% difference in heart attacks. These are the absolute differences, but of course the authors of these studies had, as usual, done the spin. That is, they applied what is called relative reduction, which ranged from 10% in mortality to 15% in stroke and 25% reduction in heart attacks. But the absolute figures were only 1.3% for heart attacks, 0.8% for myocardial infarction, and 0.4% for strokes. Now remember, these were 21 randomized studies, which included studies using a statin as a primary prophylactic, and also studies using a statin as a secondary prophylactic. Apart from this, there was a study, again a very interesting study, published in the British Medical Journal. The BMJ again is a very prestigious journal. This had a very interesting take. It had a very interesting look in 11 randomized studies, half of which were primary prophylaxis and half of which were secondary prophylaxis studies, and they looked at the extension in life. That is, if a person took a statin, how many days longer did that person live? And surprisingly, what was found by these researchers was that if you took a statin as a primary prophylactic, you extended your life by a median of only 3 days. If you took a statin as a secondary prophylactic, that is, after you've had a heart attack or have been stented or have had a stroke or have had a bypass surgery, your life was increased or extended by only 4 days, a median of 4 days. So the take-home message is that as a primary prophylactic, one must be very cautious in using a statin, because there is very little advantage, especially in people above the age of 75 years, as seen by this randomized study published in The Lancet. And also one must keep in mind that statins do come with a price. People do get an increased risk of diabetes, cognition impairment, they have myalgia, they have fatigability, they have weakness, and also they have an increased risk of cataracts and renal failure. So therefore, every case must be individualized, and there is no need for being gung-ho in taking a statin. As definitely it should not be taken with gusto as a primary prophylactic. That is, if you do not have any evidence of heart disease, and even if you have hypertension, even if you have diabetes, and even if you have cancer, a statin has little to provide in terms of clinical benefit.